Policy and Standards Division with HUD's Office of Healthy Homes and Lead Hazard Control. The division manages the awards of grants and contracts for research on residential hazard assessment and control methods. It contributes to policy development for those Healthy Home and Lead Hazard Control programs, including recent development of the office's Healthy Home Strategic Plan. He received his Doctor of Public Health degree from Johns Hopkins School of Public Health, where he conducted research on urban lead exposure. Please welcome Dr. Ashley. Well, we work with a technical difficulty.
Thank you. I'll start while we're getting the presentation up. This morning I just want to put in perspective where in-home asthma interventions fit in current federal guidance and strategies. First of all, I wanted to talk about, very briefly, of course I only have 10 minutes, but the National Asthma Education and Prevention Program guidance. A lot of you are probably familiar with that. Last updated in 2007. It's basically the Bible for asthma management, and it was developed by the National Heart, Lung, and Blood Institute. The next item I wanted to mention is the Guide to Community Preventive Services, and that's a program that's run out of the CDC. It's actually it's administered by a task force, the Preventive Services Task Force, which is composed of federal and non-federal scientists and public health practitioners. So their guidance is probably not technically considered federal guidance, but it's close as you could get. Attorneys might argue one way or the other, but for all practical purposes. And then I wanted to mention the Federal Action Plan to Reduce Racial and Ethnic Asthma Disparities. Captain Bilardo set that up for me. I just wanted to show you some of the wording in that document. And then finally, I think Matt mentioned, out of the same group, the President's Task Force, we recently announced the development of a strategy for action to advance healthy housing. And of course, this is very relevant to that document as well. So both of them were released by the President's Task Force on Environmental and Health Risk to Children. The Healthy Homes document was actually developed by the Federal Healthy Homes Work Group, which HUD has been heading up for about 3 years now, Matt. But we're not an official group, so we wanted to announce it out of the President's Task Force, better visibility, etc. So that sets it up. I'll just keep going.
Sorry.
That's all right.
Technical difficulties.
That's all right. So the NEPP Guidelines, I just wanted to mention that the guidance includes control of asthma triggers in the home. So not surprisingly, out of the main guidance from these guidelines, this is one that's been hard to implement, of course, for all the reasons that we know about, we'll talk about today. The home treatments aren't part of the traditional medical care system. So anything outside of the traditional system, it's hard to set up, it's hard to get reimbursed for, hard to do it sustainably outside of these kind of boutique grant programs like we have at HUD. The grant programs have been good for establishing evidence, local capacity, but it's just not a sustainable model with cuts in budgets, as we all know. So the NEPP Guidelines...
Welcome to GoToMeeting, online meetings made easy.
Recommend...
There is one other caller on the call.
Sorry about that. That's all right. There's 4 overarching recommendations from the NEPP Guidelines. Pharmacologic treatment, education to improve self-management skills of the patient and their family, reduction in environmental exposures that worsen asthma, and monitoring the level of asthma control with the patient's management plan adjusted accordingly. So the second and third of those 4 recommendations, education to improve self-management and reduction of environmental exposures, can be done or are important components of in-home asthma interventions. So education is usually an important important part of the in-home interventions. I'm an environmental health guy, so I tend to think in terms of environmental exposure. But the education on self-management is really critical. Let's see. So the guidelines specific language includes recommendations to identify allergens and pollutants that exacerbate asthma, and then of course to intervene. The focus on these guidelines is more education, in-home education. They were updated, as I said, in 2007. There's been quite a bit of work since then, so that means the literature they reviewed probably back it up a couple of years, maybe 2005. But we know quite a bit more now about physical in-home interventions and how important they can be. So the one conclusion of the guidelines is that multifaceted allergen control and education programs provided in the home setting can help patients reduce exposure to cockroach, dust mite, and rodent allergens, and consequently improve asthma control. So you could throw in mold as well, environmental tobacco smoke, of course, and other things. So, all right. So that's the NEPP guidelines. I'm going to keep moving. The next one I want to mention is the community guide, which I introduced. They reviewed published studies that looked at the effectiveness of multifaceted home interventions for asthma, and they completed this in 2008. They published the results a couple of years later. Okay.
Seems to be working.
All right. Okay.
You can switch the podium if you want.
Yeah.
Sorry about this. Let me just.
Batteries in this station.
The community guide recommendations. So this, I mentioned this is overseen, administered by CDC, directed by the Task Force on Community Preventive Services. The conclusions from the community guide review, they reviewed 20 to 23 studies, fit their criteria for quality, et cetera. And the conclusion is similar to the one that the NEPP guidelines concluded. Multi-component, multi-trigger home-based environmental interventions are effective in improving overall quality of life and productivity in children with asthma. And that the benefits of these interventions can match or exceed program costs. So they're cost-effective, so they're equivalent to the cost of other types of treatment, or they can actually give you a positive return on investment. And we'll talk about, I think, some of the panel information. We'll talk about that today. I just wanted to mention Dr. Dearborn, an intervention, a randomized controlled trial looking at intervening in mold and moisture was one of the studies that they reviewed at the higher end of the intervention scale because of the structural intervention in the homes. And they concluded that we have inadequate research for adults to come up with any conclusions on the in-home effectiveness. So just to break apart this conclusion a little bit, what do they mean by home-based? At least one home visit conducted by someone with training or experience. So it's pretty wide open, including health workers, environmental specialists like they have here at Children's Mercy. Some places use visiting nurses. So there's quite a bit of flexibility built in. Multi-component, the studies that they looked at had at least two components, one of which had to be related to the environment, assessment, remediation. And most of them, the other component was education oriented. And then multi-trigger, directed at controlling two or more asthma triggers. So this is the scale of remediation intensity from minor to major. HUD grants, we've provided through our grants, the ability to do structural interventions in homes, so the right side of this scale. There's not that many funds available for that. That's going to be a tough one to get sustainable. Most of the interventions in the studies that they looked at were in the moderate level. The research that I mentioned Dr. Dearborn was involved in was on the right-hand side here with the mold intervention. So Captain Bellario mentioned the release of the President's Task Force report to reduce asthma disparities in children. Go through that very quickly. It was a high-level release. So, sorry. So we had Secretary Sebelius, Sean Donovan, our boss, former Administrator Lisa Jackson here, and Nancy Sutley, who heads up the Council on Environmental Quality at the kickoff. So it was a year ago. So this is just a little bit about the President's Task Force, cabinet level interagency group. Started under President Clinton, became inactive, and then it was recently recreated, resurrected. The mission to identify priority issues of environmental health and safety risks to children that can best be addressed through interagency efforts. And that covers a wide range of things. I think asthma is a great example, but there are others, plenty of others as well. First two focus areas, of course, asthma disparities, and then healthy homes. So the focus of this action plan is on preventable factors that contribute to disparities in the burden of asthma. And a major focus area is to help with the implementation of guidelines-based care. So that's really the NEPP guidelines that I mentioned. And that, of course, includes environmental factors, taking care of or addressing environmental factors, and helping build local capacity. So that's really what we're doing here today. 4 key strategies within the plan. I'll just go through that quickly. And under each strategy are priority actions. So strategy 1, reduce barriers to the implementation of guidelines-based asthma management. And we see within that addressing or promoting home interventions at this 1.1, 1.3 in-home to reduce environmental exposure. So that's a part of it. And then finally, I mentioned that healthy homes was another focus area. So this document was released relatively recently in February. Was largely written by my office of Healthy Homes, but of course we put it out and with the other federal agencies. They all reviewed and commented on it and have added to it. We got OMB clearance before the election. That was interesting. They were very careful about every word, so it took quite a while. But this should also be useful, high-level release. A lot of the same people as the earlier document, and there's a lot of the language in here is supportive of what we're doing here today to promote the healthy homes model. And asthma is one of the, of course, key areas where home interventions can be effective. So just to let you know about that. Just wanted to acknowledge Drs. Elisa Smith and Paul Garvey, who you'll hear from right after me, for providing some of the content of this presentation. And I believe you have they have the asthma strategy document on their website. And the healthy homes as well?
Yeah.
Okay, great. Thank you very much. Sorry about the technical glitches.
Well, they're not your fault, I apologize.